Yes, once you've read the first slide, please tell me, I'll move on. I think you asked for the polytrauma case, right?
Yes, yes.
Yes. So there are just 2 lines and then there are 2 more slides. Move on?
Okay.
Yes.
Sorry to butt in. Just how much time do we get to read the stem? 1 minute or?
You'll get the stem outside 1 minute, then you'll have 9 minutes of preparatory station, in which you'll be given all the whole journal of the patient, and you'll go through the notes and you'll prepare your whole station in those 9 minutes.
Yeah, thank you.
Yes, no worries. That's why I'm giving him time. Once they are ready, they'll let us know.
Okay, ma'am.
All right, next.
Yeah. Okay, ma'am.
All right, so if you've read and understood, considering it communication skills station, please begin.
Hello.
Yes, hello.
I'm Dr. Mahir, one of the surgical doctor working with Mr. Mann in working here. I'm calling to speak to the trauma consultant, the on-call trauma consultant, to update him about a patient with tibular and fibular fracture with pulseless extremities and abdominal distension. Could I confirm that I am speaking to the on-call consultant?
Yes, go ahead.
Yes, I have this Mr. Ahmed. He's 20 years old and he's a motorcyclist. And he involved in a road traffic accident 2 hours ago. And clinically, he was unconscious before arrival at the hospital. But when arrived, his GCS was 15. He's hemodynamically stable. And his lab investigation was normal, apart from increased C-reactive protein. He's also having a left flank abrasion. And we did X-ray, and his X-ray showed right tibia and fibular fracture. His ultrasound was concluded that there is free fluid in the paracolic gutter. At maybe 1 hour before, the nurse called me, and because the extremities are pulseless, when I went to examine him, his extremity is pulseless, cold, and pale, and he is having worsening pain. So I'm calling to speak up to update you about this patient, about his pulseless limb.
Okay. So is it urgent? We can send it tomorrow.
Yes, it's urgent, sure, because the patient is having pulseless limb. So I fear that he may go into compartment syndrome, or this having the ischemia, which will lead to losing his limb.
Why do you suspect acute limb ischemia?
As I said, he is having a worsening pain in the limb, and he is having a pulseless extremity, cold and pale extremity, and also he have open fracture in the same limb.
Okay. And what do you think the cause of arrhythmia?
Of limb ischemia, you mean, or arrhythmia?
Arrhythmia.
Okay, that could be due to electrolyte imbalance.
Okay. What is the differential diagnosis?
Yes, my differential is that this limb, this
For
pulseless limb.
abdominal cause?
Yes, the abdomen could be perforation or injury to great vessel, or perforation of bowel or polyviscous. This
Okay.
could be also injury to the kidney or spleen.
Do you want to scan the abdomen first?
Yes, we need to scan the abdomen, but this his limb is more urgent.
Okay. Could it be mesenteric ischemia?
No.
No. Yes. No. It could not be mesenteric ischemia because yes, his abdomen is okay now. It's so soft, but this one because he's trauma case, so I suspect that he's having either injury to the vessel or injury to the kidney or injury to the intestine.
What image to do for that?
Yes, I did ultrasound abdomen and it shows free fluid at the paracolic gutter.
Okay,
But
what
also,
image we will do for this patient in general for the acute limb ischemia?
Yes, for the acute limb ischemia, I would do first duplex ultrasound, and if I am going for further, I may do angiography or CT angiography for the limb.
Okay, how would you transfer the patient, and what will you will be prepared for that?
Yes, I am not going to transfer the patient. I'm just updating you. I'm very sorry. I'm updating you about this trauma case because the patient may need overnight surgery. You know, he's having limb ischemia now, and he's admitted at our ward, and he have fracture at the tibia and fibula, and so yes, maybe he need overnight surgery.
Okay, so the management plan for that?
Yes, my management is to start resuscitation of the patient with IV fluid, and then I would do duplex ultrasound to confirm the cause or site of this obstruction to the vessel or kinking of the vessel or injury, and then I would go for surgery if I confirm the site, and because he need urgent surgery for revascularization this one limb.
Okay, what do you think the ECG will find?
I think you're mixing this station with the previous one. So how would you plan to fix the fracture of the patient?
Yes, I fix by external fixation because there is open fracture, so it will help to restore the bone continuity, and then it will help for the soft tissue coverage.
What would you do for the wound?
Yes, I will cover with gauze and
Debridement
yes, I will.
for the necrotic tissues. Yes.
Yeah, I will do debridement. Then I will transfer the patient to the theater to do debridement at the theater.
Does the patient have C-collar? Cervical
I am
collar?
not sure, but I will. Yes, I will make sure as soon as I am off the phone that the patient is on cervical collar.
All right. Can you please tell me what is the most urgent in this patient, which needs to be managed first?
Yes, first we need to urgently manage the limb ischemia. Then we will go for the abdomen to check for the abdomen. Maybe it will be the same operation at the same time, because this free fluid, we need to do CT scan and to confirm if there is this free fluid confirmed, and then we'll go for laparotomy also.
Who would you involve for this management before procedure and during operation?
Yes, I will involve the consultant surgery, and I will involve the plastic surgery, the neurosurgeon, and
Not neuro, vascular, operation theater, anesthetic, general surgeon, vascular, and plastics. Okay, please tell me, why do you think general surgeon should be involved?
First, the patient may have compartment syndrome, then he's having open wound, need debridement, and thirdly, he's having intraperitoneal collection, so maybe we need to go into laparotomy.
Right. Do you think patient is dehydrated?
Yes, patient is dehydrated because he's losing blood.
Okay, this information is not mentioned in the notes, so you cannot say. Remember, you cannot say yes, patient is dehydrated. You have to say that I'll confirm it and I'll let you know. Okay.
Yeah, sure.
Yes. Right. What more is left? Okay, plan of management you've already discussed. All right, good. Thank you.
Yes.
Thank you. Thank you.
Yes, ma'am. Thank you.